Hello, everyone. My name is Dondra Edwards. I'm with Transition Acceleration Group, and I'm here today to talk to you about SOAP notes, clinical notes for the medical billing team. Now, just a quick disclaimer before we get started. The information contained in this presentation is not intended to provide you with information to code claims. It is merely a high-level example of SOAP note-taking, and therefore it is missing information that you would need in order to bill a claim properly. So please do not use this information to try to create a claim. So let's start by defining what a SOAP note is. A SOAP note is a standard method of documentation adopted by the healthcare industry to write out notes in a patient's chart. Now, if you come from a medical environment, a SOAP note is very common. However, in the world of dentistry, it is not as common, and there's very few people that actually use this method. I will tell you that creating a standardized method of note taking will save you tons of time in the future, especially as a biller when you're having to go back and grab information from the clinical note section in order to gather information to create or submit a claim. Now, SOAP is an acronym, and it's basically standing for subjective, objective, assessment, and plan. So let's talk about the subjective section of a SOAP note. Basically, it's why did the patient come in? It's the conversation that usually the dental assistant has with the patient to identify what issues that they are having and what prompted them to come in and have a conversation and speak to the doctor about the problems that they're having. Now, there's a couple things about the subjective section that you need to identify. Number one, you need to understand what the chief complaint is from the patient. What is it that brought them in? And then you want to kind of dissect that information a little bit. How long has this been going on? Where do you feel the pain? Was there an event that caused the issue or pain? Can you describe the pain? Does the pain radiate to other places? And if so, where? And then using the pain scale of 1 to 10, what's your pain level? You take all of those questions and answers and then look at the medical questionnaire to confirm medications and allergies to really get a visual image of what's going on with the patient. You're going to document that information, and you're also going to transfer that information to the doctor verbally when they come in to see the patient to do their section of a SOAP note. Okay. Now, I've included a little bit of dialogue here for you just to kind of get an idea of how this process will flow in your practice. Now, in most cases, you all are probably doing this already, but just in case you need an example, I've provided this for you. Now, when you're having the conversation with the patient, ideally you need to be sitting at your computer or with the paper chart making notation of what is happening and what the patient is actually communicating to you. Okay, so here's a little bit of the dialogue. Mr. Jones, before we get started, can you verify your date of birth for me? And then the patient's going to verify the date of birth. Please make sure that you're verifying some personal information before you start entering information into your practice management software. You really need to verify that the chart that you have open is for the person that's sitting in front of you. So please make sure that you verify a piece of information on that patient before you do any treatment and or take any information from them. All right, so let's continue. So the dental assistant says, what brings you in today? And the patient's telling them that they're having a hard time chewing their food. Their teeth feel loose. They're pointing to the upper right side of their mouth, and they have sores in their mouth. And so the dental assistant's going to dissect a little more of this. Are you having pain when you chew? The patient says, yes, it hurts when I bite down. So we've got pressure issues here. How long has it been going on? Several months, and it's getting worse. That's a critical piece of information for the doctor to know that it's not staying the same, it's getting worse over a period of time. And then using a pain scale of 1 to 10, how would you rate your pain? And the patient says, I'm an 8. On a scale of 1 to 10, 10 being the worst, this patient is in a lot of pain if they're at an 8. So the dental assistant continues and says, listen, I noticed on your health history you marked radiation treatment. When did you have the radiation treatment? And the patient says, 3 years ago, I was diagnosed with cancer and I had chemo and radiation. The dental assistant says, I also noted that you made mention of dry mouth on your questionnaire. And the patient says, yes, I was told that it's a side effect of my medication that I'm on. So, of course, you're going to have those medications so that the doctor can see what the medications are. Now, when the doctor comes in to do the evaluation or exam, that is the objective paragraph that you're going to be documenting. And basically, you are going to document what the doctor finds during the exam. Okay. Now, I am speaking to you as if you are the dental assistant. If you are the biller, you will go to the objective section, which is the second paragraph of the SOAP notes, and you will look and see what the doctor found during that examination. It should be consistent from every patient. Paragraph 2 will be the objective section, which is what the doctor is finding during the exam. Now, in our example, the doctor finds all kinds of stuff, right? They're looking at the previous x-rays and they're also looking at the current x-rays. They see that there's extensive carious lesions on certain teeth. They have poor oral hygiene and a whole slew of other things that they are identifying that's wrong with this patient. So now we have what the patient has identified as the issue. The doctor is now confirming some of these things and identifying some issues that they might be finding. And now we move to the assessment part of a SOAP note. The assessment is just where you are creating the diagnosis of the findings. This is where you determine why the patient is having the symptoms that they're having, like what's causing it. Now, with the assessment section, the doctor is not going to know the actual ICD-10 codes, okay? They're not going to know those codes. I've included them on this slide just as your reference point. Please do not use them to create a claim, as I have said before. But basically, they're going to identify or call out what the diagnosis is. You're going to make note of that. The biller will then have the ability to look at these diagnosis and then cross-reference them to the ICD-10 codes, okay? The doctor, again, is not going to know what those codes are, but the biller will be able to gather the information based on the document in the assessment section. And then the final part of the SOAP note is the plan. It's the treatment plan. You're going to provide a treatment plan based on the phases of the treatment. Here's an example of what your clinical note would look like in a SOAP format. The first paragraph, again, is documenting what the patient is telling you and what their chief complaint is, why they are there. The second paragraph is showing the doctors providing the exam information and what they have found. And then the third paragraph is actual diagnosis. And then the fourth is about the treatment. And notice there's a reference to a full scope treatment plan in the document center. Now, we all know that clinical notes are really critical in getting dental claims paid. They are even more critical in getting medical claims paid. You need to be able to have clear, concise, written clinical notes so that a biller can identify what the issue is, what the treatment is, and any of the diagnosis codes. It's very, very important. If you use the SOAP notes format, it's going to create some efficiency and allow you to gather information much faster than reading through a very long paragraph to find one piece of information. If I'm a biller and I'm needing to know the diagnosis, I can go to the third paragraph, which will be the assessment paragraph, and identify what the diagnosis for that visit was. If I need to know any additional information, I can find it in the other two paragraphs if needed. So having those notes is very important in order to be able to successfully bill out medical claims. Now I've created kind of a little cheat sheet here for you. You can do a screen capture or print this page. You can lay it on the counter next to the computer for your hygienist and your dental assistant to be reminded of the format in which they need to create their notes. So the first section, again, chief complaint, why, when, where, severity of pain. Objective, document what the doctor finds during the exam, and note that I put in here document blood pressure. Now, many practices do not take a patient's blood pressure. If you are doing general dentistry and you are not billing to medical, you may be fine by doing that. But let me just say this: if you are billing medical claims, you need to understand that there's a paradigm shift. You are a medical facility that is providing dental procedures and medical procedures. It's really important that you understand that you are not billing dental procedures to medical insurance. You are billing medical procedures, true medical procedures of the head and neck, to medical insurance. And so you're going to have to do things differently. Dental and medical insurance are not the same. So you've got to learn some new terminology, and you also have to implement some new protocols in order to be able to bill medical billing effectively. Please note that before you start taking someone's height, weight, and blood pressure, that you train your clinical staff on how to answer questions. I'm sure the very first time a patient comes in and you ask them to get on a scale, they're going to look at you a little funny about, why am I giving you my weight at a dental office? And so you want to make sure that you have trained your clinical staff in how to respond to those questions and those looks that you're going to get from your patient. But it's really important, if you're billing medical exams to medical insurance, that you document blood pressure, height, and weight. Now, the assessment is basically the diagnosis based on subjective and objective data. It's going to allow the doctor to establish a treatment plan to address the issues, and also provide the biller with the information to submit the claim. Remember that the most important diagnosis code needs to go first. And then, of course, the treatment plan. So that in itself is going to give you very good information in an organized fashion. This cheat sheet will allow your dental assistants and hygienists to be able to organize their thoughts and their notes to help when claims are being billed out. All right, if you have any questions, you can contact us at more information at transitionag.com, or check out our website at transitionacceleration.group.com. And coming soon is TAG Academy, where we are going to be teaching the business of dentistry. And we're going to have a lot of content on our website. Some of the content will be free. We'll be offering some webinars and also some CE credit live instructor-led training for the doctors and office managers. So I look forward to seeing you and answering any questions that you may have. And remember that if you're doing your notes, use the SOAP method.